How does someone die from a stroke? As a doctor, I hear this question every single day, and it's never asked casually. It comes wrapped in fear, in grief, in the desperate need to understand what just happened to someone they love. So, let's answer it properly. Because understanding how stroke kills isn't morbid. It's the most empowering thing a caregiver or family member can know. By the end of this video, you'll have the full picture and the practical steps to act on it. The first thing to understand is that a stroke isn't usually a single instant event of death. It's a process, a cascade of failures. It can be a rapid, direct assault on the body's command center, or it can be a slow, drawn-out battle against complications that show up long after the initial injury. There are really two different paths to fatality after a stroke. The acute phase, where the brain suffers a catastrophic and immediate injury, and the long-term phase, where the body gives in to the ongoing consequences. To really get it, we need to look at both of these difficult paths. In the first hours, days, and weeks after a severe stroke, the patient is in the acute phase. This is when the risk of dying is highest. Death here isn't a gentle fading away. It's often a direct and brutal consequence of the initial brain injury. In fact, a staggering 90% of deaths in the first week after a stroke are due to these direct effects on the brain. This path to fatality is dominated by a single, terrifying mechanical problem. Pressure. Your skull is a sealed, rigid box. It contains your brain, blood, and cerebrospinal fluid, all in a delicate balance. There's no room for anything extra. When a severe stroke happens, it sets off a chain reaction that threatens this balance. The initial injury, the dying brain cells, triggers a massive inflammatory response. The body sends fluid to the site, causing the brain tissue to swell. This is called cerebral edema. In any other part of your body, swelling is normal. A sprained ankle swells up, but the skin stretches. The skull can't stretch. As the brain swells, the pressure inside this fixed box, known as intracranial pressure, ICP, starts to climb. In a hemorrhagic stroke, this is even worse because the pooling blood from the burst vessel adds even more volume and pressure. This rising pressure is the first step toward disaster. It starts squeezing healthy parts of the brain, and critically, it can compress blood vessels, cutting off even more blood flow and causing more brain cells to die, which in turn leads to more swelling. It's a vicious, escalating cycle. When the pressure gets too high, the brain has nowhere to go but down. It begins to push through the only available openings in the skull, like the rigid membranes that separate brain compartments, or, most catastrophically, the opening at the base of the skull where the spinal cord connects. This is called brain herniation. It is the single most common reason people die in the acute phase of a stroke. The odds of death skyrocket when it happens. Imagine trying to force a sponge through a small hole. It gets compressed and torn. That's what's happening to the brain tissue. The most lethal type of herniation is when the brain is forced downward, compressing a small, stalk-like structure at the base of the brain, the brainstem. The brainstem is the body's life support control center. It's a primitive but absolutely essential part of the brain that regulates our most basic functions, our heartbeat, our blood pressure, and most importantly, our breathing. When brain herniation crushes the brainstem, these functions fail. The patient's breathing can become erratic and then stop completely. Their heart rate and blood pressure become dangerously unstable, leading to circulatory collapse. They lose consciousness and slip into a coma. This damage is often irreversible. This is how someone can die from the direct neurological effects of a stroke. It's a cascade. Stroke leads to swelling, swelling leads to pressure, pressure leads to herniation, and herniation crushes the brainstem, switching off the body's life support. Hemorrhagic strokes are especially lethal here. A large bleed can cause death within a day or two just from the rapid buildup of the blood clot itself. But even if a patient survives that initial storm, they aren't out of the woods. The acute phase also brings other deadly complications that often become the leading cause of death in the following weeks. The first major threat is a pulmonary embolism, PE. Between the second and fourth week after a stroke, this becomes a huge risk, accounting for up to 30% of deaths during this period. A stroke often causes paralysis or severe weakness, leaving the patient immobile. When the legs aren't moving, blood in the deep veins can pool and form clots, a condition called deep vein thrombosis, DVT. If a piece of that clot breaks off, it can travel through the bloodstream to the lungs, block blood flow, and cause a sudden, often fatal event. The second major threat is infection, especially pneumonia. Pneumonia is a leading cause of death in stroke patients, responsible for around 27% of deaths in the second and third months. Why? Many stroke patients have trouble swallowing, a condition called dysphagia. This makes it easy for food, drink, or even saliva to go down the wrong pipe into the lungs, carrying bacteria with it. Patients on a ventilator are also at a much higher risk. The combination of a weakened immune system, being immobile, and trouble swallowing creates a perfect storm for a deadly lung infection. So, the acute phase is a war on two fronts. First, there's the immediate, life or death struggle against the direct brain damage and the pressure crisis. Then, for those who survive, a second battle begins against complications like blood clots and infections that arise because the body is weak and immobile. Surviving the acute phase of a stroke is a huge victory, but it's not the end of the story. For many, it's the beginning of a chronic condition, a life that's been forever changed. The risk of death for a stroke survivor stays much higher for years, with some studies showing a 5-year mortality rate as high as 60%. This long-term path to fatality isn't usually about the original brain injury. It's driven by two main forces: the underlying diseases that caused the stroke in the first place, and the new medical problems created by the stroke's lasting disabilities. The single biggest cause of long-term death is cardiovascular disease. This includes both repeat strokes and heart problems. It's important to remember that a stroke is rarely a random event. It's usually a symptom of a larger problem. The same conditions that led to the first stroke, like high blood pressure, high cholesterol, diabetes, and hardened arteries, are all still there. This means the risk of a recurrent stroke is terrifyingly high. Nearly 1 in 4 strokes are in people who've already had one, and some survivors have up to a 41% chance of having another within 5 years. A second stroke is often more devastating than the first because it's hitting a brain that's already damaged. But the threat isn't just to the brain. The arteries throughout the body are often in the same bad shape. This makes heart attacks a major cause of death in the months and years after a stroke. One study found that heart disease was the leading cause of death for patients who died more than 3 months after their stroke, accounting for 37% of those deaths. The stroke is a massive warning sign that the entire circulatory system is in danger. Beyond that, there are the secondary causes of death that come from the long-term consequences of the stroke itself. Just like in the acute phase, infections are a constant threat. A survivor who is left with significant disability, maybe bedbound or with limited mobility, is always at risk for pneumonia, urinary tract infections that can lead to sepsis, and infected bed sores. Multiple organ failure is another major long-term risk. A severe stroke puts incredible stress on the whole body. Over time, things like chronic infections, poor nutrition from swallowing problems, and kidney issues can cause a domino effect, where one organ system after another begins to fail. Finally, we have to talk about the causes of death that show the profound human toll of surviving with a severe disability. Stroke is a leading cause of serious long-term disability. This can increase the risk of fatal accidents like falls, and, heartbreakingly, it can lead to despair. Stroke survivors have a high risk for depression, and the higher death rate for survivors also includes suicide. It's a stark reminder that the battle after a stroke isn't just physical, but deeply mental and emotional too. Hearing all this can feel overwhelming and scary, but this knowledge isn't meant to create fear, it's meant to empower. For caregivers and family, understanding how a stroke can be fatal is the first step in knowing how to fight back. In so many stages of this process, there are chances to intervene, to provide care, and to change the outcome. In the acute phase, time is everything. The phrase "time is brain" is the single most important thing to remember. Your first and most critical job is to recognize the signs and act fast. The acronym B.E.F.A.S.T is a lifesaver. B for balance. Is there a sudden loss of balance? E for eyes. Is there sudden blurred vision or loss of sight? F for face. Does one side of the face droop? Ask them to smile. A for arms. Is one arm weak? Ask them to raise both arms. Does one drift down? S for speech. Is their speech slurred or strange? T for time. If you see any of these signs, it is time to call for help immediately. Don't drive the person to the hospital yourself. Calling an ambulance means medical care starts the moment they arrive, and they can alert the hospital to get the stroke team ready. This is critical because for ischemic strokes, there are powerful clot-busting drugs and procedures that can restore blood flow, but they only work within a very narrow time window, sometimes just a few hours. Every minute you wait is a minute where more of the brain dies. Once in the hospital, the medical team will focus on stopping that deadly cascade of swelling and pressure. In extreme cases, They might even perform a surgery where a piece of the skull is temporarily removed to give the brain room to swell. As a caregiver, your job here is to provide information, support, and ask questions. Be alert and report any changes you see in your loved one's condition. You also play a key role in preventing those early complications. Encourage movement as soon as it's safe to help prevent blood clots, and make sure swallowing assessments are done before your loved one eats or drinks to prevent pneumonia. After the hospital, the caregiver's role becomes even more central. You are the frontline defense against the long-term causes of death. This is a marathon focused on preventing a second tragedy. First up is medication adherence. The medications prescribed after a stroke are lifelines. They typically include 1. Drugs to control high blood pressure, 2. Statins to lower cholesterol, 3. Blood thinners like aspirin to prevent clots. Your job is to help make sure these are taken exactly as prescribed every single day. Next is managing other health conditions. This means working with the doctors to aggressively control things like diabetes and atrial fibrillation. It means monitoring blood sugar, taking blood pressure readings at home, and going to all the follow-up appointments. Rehabilitation and lifestyle changes are just as important. Actively participating in physical, occupational, and speech therapy is crucial. Encouraging a healthy diet, helping the person to stop smoking, and finding safe ways to be physically active are all powerful ways to reduce the risk of another event. Finally, just be vigilant. You know your loved one best. Watch for the signs of another stroke. Be alert for signs of infection, like a new fever or cough. Pay attention to symptoms that might suggest a heart problem, like chest pain. And, just as importantly, watch for the signs of depression, withdrawal, sadness, or loss of interest, and get help for it. Mental health is every bit as important as physical health in this long-term battle. So, how does someone die from a stroke? They can die within minutes from a catastrophic bleed. They can die within days as their brain swells inside the skull, crushing the very centers that control life. They can die weeks later when a blood clot travels from an immobile leg to their lungs. Or they can die years later from a second stroke or a heart attack, the consequence of a body in crisis. The path is complex and devastating, but it's not unconquerable. From the second you recognize the signs and call for help, to the daily diligence of managing risk factors years later, there are crucial moments. These are the moments where action can be taken, where complications can be prevented, and where lives can be saved. Understanding how a stroke kills is the first step to understanding how to survive it. It turns fear into vigilance and vigilance into a powerful, life-sustaining force. Thank you for watching. If you gained any value from this video, please consider subscribing, as this genuinely helps this information reach more people. I will see you in the next video.